All right, what's up, everybody? Welcome to Overcoming Average. So we have a couple of guests joining us today. The co-host Rick Stewart and his wife Melissa, and of course the most special guest, my wife Kimberly Keith, who's a lot better at talking to people and interviewing people. So we wanted to talk about sort of a serious subject today, and that is cancer. So my mom was diagnosed with throat cancer right before Thanksgiving, and my mother-in-law passed away from pancreatic cancer, and Melissa has survived breast cancer. And so with the coronavirus and stuff, I was kind of looking at some statistics, and in 2019, 1.7 million people were diagnosed with cancer, of which almost 700,000 of those people died. So, we worry ourselves with coronavirus, but every year regularly people die of cancer of all types. So, Melissa, you just got done with a crazy treatment. I was going to have Kim join and kind of talk about your experience, because I know that just with what Kim and I have experienced, there's so many emotions, but you have to like live, you have to wake up in the morning and you have to, make breakfast, like things that seem mundane, but there's like this cloud hanging over you. Mm-hmm. So I just wanted to, have Kim, especially with this being the type of cancer it is, have Kim kind of navigate and talk about your experience, and hopefully other people will listen and hear. Yeah. Because I think, and Kim can attest to this probably, that just having other people that have walked the path, knowing you're not alone, you're not the only one that has been down that road, is a very important thing. So, so Kim, why don't you kind of kick it off and ask Melissa some questions?
Yeah. And to follow up with what Chad was saying, I think we could all agree that stories are important, and hearing the stories of others is important to provide multiple perspectives, but also to remind people who are walking through the same thing that they're not alone. Mm-hmm. And so I think that's a special part of your story too, that hopefully someone can hear this and realize, it's not just me, or feel validated in the emotions they're feeling while navigating something similar. So I want to talk little and have you tell your story. So why don't you start off by telling us kind of how you discovered, walk us through what it was like to think, to be in the spot to think, okay, what is this? I need to go to the doctor. I'm not sure what this is. This might be something more. Kind of walk us through up until your diagnosis.
Okay. I think that's the most commonly asked question, is what made you go to the doctor? Because you weren't 40. Mammogram wasn't the normal, you usually don't have your first mammogram until you're 40. And I was 37 so it was the spring of 2018. Yeah. I went for my normal annual OB appointment, and I said, I've had this pain in my rib, like right under my breast, and it's been a year and a half. My husband's a physical therapist, and so I'd had him do anything that he knew to do for it, to whatever. I
failed. I didn't fix it.
He failed. I tried ibuprofen for a week. I tried different bras for periods of time. I don't know. And this pain was still there. And everyone says, cancer doesn't hurt. So I was like, I'm pretty sure, I know it's not cancer, but my OB was like, at this point, we can send you for a mammogram if it just makes you feel better. She said, I've had one other woman in your situation and it did end up being cancer. Out of who knows how many people she's sent. So I said, let's just go ahead and do it. So I think that was April of 2018. I went for my mammogram, and they did what they do. And the doctor came back in and said, we want to get a couple more pictures because there is an area that there's some spots. So it's like, okay. So they take some more pictures, and she comes back in and she's like, it could be nothing. As you get older, there's calcifications that just naturally grow in your breast tissue. You're really not to that age yet, but it could be. It could just be that you're on the earlier side of it or whatever. Come back in 6 months. We'll take another picture and just see, if anything has changed. So I really didn't think anything about it in that 6 months. The most I thought about it was I really should just cancel this follow-up because I know it's fine. It's a waste of my time. It's a waste of insurance money. It's,
Which I wonder how many people
oh, yeah,
have done that now that you say that, because I probably would have done the same, but continue.
Yeah. And, a mammogram is necessary. I am all for it. I think everyone should go when it comes to that time. But it's awkward, it's just one of those things. So anyway, I did end up going. And I actually had looked at my calendar a while back, and we had we had a rental property, our first house in Charlotte, and we had closed on the house that morning. And then I went right to this follow-up mammogram. And they did the mammogram again, and they said, it does look like there's been some changes, maybe a little more growth, or I don't remember exactly. But we're going to take you to the room next door and do an ultrasound. So I'm like, okay. And the whole time I'm thinking, this is such a waste of time. Like, this is so silly. Like, this is how people get roped down the line of, testing. And so anyway, we go next door, and another doctor comes in. She does the ultrasound, and she said, your duct, there's milk ducts in your breast. It looks dilated. There's some fancy name for it. She said, but usually if it's anything too concerning, there's other, it looks a certain way. And as you get older, or if you've been breastfeeding, like, this could be normal. She said, but just to be safe, we're going to send you for a biopsy. And again, I'm like, really, this is so silly. It's not necessary. So anyway, that was September. It was October 8th. I went for the biopsy. Super awkward again. Like, it's basically a mammogram, and then they do take like this needle and stick it in and pull out a sample of the,
And this is in the office or in the hospital?
This is in another office.
Okay.
And the whole situation was just, it's a room full of, there were like maybe 4 women, like nurses or assistants, whatever, in there. And they're doing their thing and trying to get me all situated. And then this male doctor comes in that's going to actually do the biopsy. And he's like scolding the nurses on something that had happened earlier. And I'm thinking, I don't want to be here to begin with. And you're just making this worse. Yeah. Anyway, so then they start doing it. It's super uncomfortable, awkward. And I'm crying because I'm thinking to myself, I'm so mad at myself for letting them do this when I know that it's not cancer. Like, I know it's fine. My mom had. So
you had convinced yourself that it wasn't anything, and you were just going through the steps because they recommended it?
Yeah.
Okay.
Yeah. I fully was just going through it because I guess the one time that it was a good thing that I didn't stand up to my doctor and say, no, I'm not doing it.
Sure.
Okay.
Yeah.
And my mom had a history of lumps or, whatever. She'd had a lumpectomy at some point. So anyway, they do it. We're done. And I had a follow-up appointment, I think 5 days later. And I just knew they were going to call me and say, we don't need you to come in. Everything was fine. We're not going to waste any of our time. Mm-hmm. So the day of the appointment came, and I'm like, okay, they haven't called yet, but, whatever. So I was out for a run, and the nurse called me. The nurse said it, like, I knew her. She had helped me, like, get ready and stuff. And she said, don't be concerned. This is totally normal. But we don't have your results back yet because they're sending your biopsy sample to the Cleveland Clinic. Mm-hmm. And that was the first time it hit me, like, this could be real. Like, this really could be something. Mm-hmm. So actually Rick's dad was visiting, and Rick was at work. So I think I just went right back to the house. I didn't finish my run. Mm-hmm. And I'm like messaging friends or something on the front steps, like crying. Because I didn't want to go in the house to his dad. So anyway, so they told me to come in, I think that must have been like a Thursday or something. They said, come in on Tuesday and we should have the results. So we go in on Tuesday and Rick came with me. I don't even know if you were going to come with me for that appointment that they canceled because I was just sure everything was fine. So we go in, and again, it's this cold male doctor. And luckily the nurse that I knew, but even she was like not being super warm. And they come in and they're like, you have atypical cells that we found in the biopsy. It's not cancer, but they are cells that, what is it, like 40% chance that they could turn into cancer. It was something. Anyway, there was just an increased risk that these cells, they were
Either
basically cells morph.
Sure.
And they had morphed a little bit, and they could stop there, or they could continue into cancer.
And so this was the moment, the confirmation where you went from, this is nothing, I'm just going through the steps because they've asked me to this realization that this is something more. Walk us through where your mind was at that moment. I remember when my mom, when they confirmed that it was cancer, and I remember a certain set of feelings and thoughts and predictions shaping my mind for what was to come next. And of course they were not confirmed, not scientific, but when I heard that word cancer, there was a certain mentality that I adopted, whether or not that was accurate for her prognosis. But I also wasn't the one with the diagnosis. So tell us what went through your mind. What were your feelings? What were your emotions when you heard that this is no longer nothing? This is potentially something,
right?
Especially as a wife and a mom. Tell us what that was like.
I think still even that in that moment, and I see this as a huge blessing, that my mind still wasn't going worst case scenario. And from my understanding, which now looking back, I know wasn't an accurate understanding, but again, I see it as a blessing because I wasn't spending those days. I mean, this was pretty drawn out. This was middle of October. I still wasn't thinking. My understanding was that doctor recommended I have a lumpectomy, and they would take out this cluster of cells because it wasn't even a lump. It was just like, these cells.
So I think it was cancer, but it was just in the duct. So it wasn't technically breast cancer, but it was ductal cancer.
But the cells that they got on the biopsy it's called ADH, atypical ductal hyperplasia. So basically, like I said, just cells that had kind of started to do something funny. So my understanding was they would do a lumpectomy and take all that out and I'd be fine. No concerns, right?
Yeah.
So my lumpectomy was scheduled for beginning of December 7th, the day after our daughter's birthday.
So this is 2018
18,
still?
yeah.
Okay.
Or no, yeah, 2018.
Yeah.
So it was 2 months or almost, month and a half
October.
between that appointment where I got the results and the lumpectomy was scheduled. So I got home from that appointment where they gave me the atypical cell diagnosis, and the doctor that they were sending me to for my my lumpectomy, called me, and she said, it had been like half an hour of being home. She called me and she said, I just saw that they've scheduled you for a lumpectomy, and it's a little ways off, and I just wanted to talk to you and make sure you don't have any questions that I can kind of,
And this was
take
the
care.
surgeon.
This was the surgeon, yeah. I think I had met with her one other time at some point. I had even talked to her then. I said, you know what? I've always thought about augmentation. I said, so at this point, would I be better off just going ahead and getting a mastectomy and doing reconstruction? And she's like, whoa. Let's slow the train. Like, that's
something that I think, and I don't know if you thought about this or I think the first time I've heard of that even being something proactive for cancer, particularly with genetic testing. Angelina Jolie had genetic testing and found she was a higher predisposed to breast cancer and had double mastectomy and reconstruction surgery. And I had, up until that point, I don't know when that was, but up until that point, I had never heard of that as something proactive or anything for breast cancer.
Right.
That was maybe elective to circumvent any potential
Right.
life-threatening diagnosis or advancements in cancer. So that's really interesting. I didn't know that I've talked to you through this, but I didn't know that was something you proposed. So tell us what she said and kind of how that navigated through your treatment.
And she said, that's really getting ahead of things. That's a process that you really basically don't want to go down if you don't need to. Mm-hmm. She said, we can do genetic testing. We can get you in and do that. So if you're BRCA positive, which is the gene for breast cancer. And I had an aunt and my grandmother who had breast cancer. So I went ahead and did the genetic testing.
Yeah, I don't think I knew that you did that.
Mm-hmm.
Okay.
And it all came back negative.
Okay.
So they test for all of the cancer genes.
Yeah, I've had that done before. After my mom, because my grandfather also had pancreatic cancer, and so we had that done too, and it came back, same thing, breast, colon. Yeah. Okay.
So all that came back negative. I remember it was just after Thanksgiving I got those results. So, it was good to know. So then it gets to December 7th. I go for the lumpectomy. And again, my understanding was they're just going to go in. They're going to take this cluster of cells out. That's all that needs to be done, right? So I think a week later, I had an appointment with that surgeon, which was, the one that had called me. And Rick had asked me the night before. I said, I have that appointment with Dr. Birch tomorrow. And he said, do you want me to go with you? And I was like, no, it's just a follow-up. Like, she's just going to check and make sure my incisions are fine, whatever. And he's like, well, don't you have pathology coming back? And I was like, oh, maybe, but it's fine. I can go by myself.
So you're still kind of saying this is going to be okay. It's going to end here mentally.
Right.
Okay.
And honestly, I didn't think it was possible to go anywhere else. I thought they were just taking it, know. So I go for the appointment and talk about the way where your mind goes when you hear that word cancer. We're sitting there and I'm sure she had read the results before, but she had her laptop in front of her and she's reading, stage 0 ductal carcinoma in situ. And as I heard her say the words carcinoma, my mind thought, there must be a different meaning for that. Like, seriously.
Wow. Oh, wow.
That's how in denial I was.
And was Rick with you at this?
No, I was by myself.
Oh, okay.
So I'm sitting there crying and she's like,
oh, Melissa,
do you have someone with you? And I was like, no. And I'm like defending him. No, I told him, my husband, not to come. Like, I thought I was fine,
Yeah.
So
that's how much you convinced yourself.
Yeah.
Wow.
Yeah. So then she went over, she said, we could do another lumpectomy and just make sure we got everything, because I don't think she could guarantee that the margins.
Yeah. Borders weren't clear.
They weren't large enough.
They'd have to do another lumpectomy and then chemo.
Radiation.
Yeah.
Yeah. It was radiation and a lumpectomy. She said, or you can do a mastectomy. And I said, you know what? I'm not interested in radiation if I don't have to. Yeah. Let's just do the mastectomy.
And did she say, when she recommended the mastectomy, that was 100% wipe out any possibility of it spreading? What was her recommendation as far as prognosis for if you walk down the treatment plan versus mastectomy? And you're talking through all these options without anyone in the room.
Yeah.
Okay.
Yeah.
Goodness. You're strong.
And I don't know how much I was absorbing it, and I already knew that I would avoid radiation or chemo.
I think I was there for that because I remember
there was a pre-op appointment before my mastectomy
where they went over
that
again.
Rick went over, and we talked about those options again.
So back in the doctor's office, you're in this moment and you're talking through mastectomy, and how did that appointment end? Because I know how it ended, but how did you walk out of that room? And I'm curious what do you do next? How do you convey that to Rick? How do you engage in that conversation?
So this is probably where I'm going to get teary. We talked about the options and I said, no, we're just going to do mastectomy.
Mm-hmm.
And that would take my chances of down to 5% of ever getting breast cancer again. And I was like, you know what? That's what I want at this point. I'm young enough. I have many years and I don't want to have to worry about it.
Yeah.
You
So
know?
it was 30 to 40% chance it would come back in 10 years. That another ductal carcinoma.
With radiation?
If they just did the lumpectomy
Okay.
and the radiation, it'd be a 30 to 40% chance to come back in 10 years.
Basically, if I still had breast tissue, there was that risk.
30, 40.
30-40%.
And the mastectomy would take you down to 5.
To 5.
And she's 37, so that takes her to 47. So if she's 60, 70, 80, it's going to be a 50, 60, 70, 80% chance that it would come back. So
it's yeah, I can as a mom, as a wife, as a many years to see and to live. Yeah, that seems like the easy choice.
Yeah.
Did that
To
feel
me,
easy
it felt
to
easy.
make? Okay.
Yeah. And since then, I've had people say, "Oh, you're so brave," and I'm like, "What made me brave?" Like, I feel like I did what I had to do. Like, to me, there wasn't really an option. I think being brave would take the other road and say, "I'm not going to take any treatment and just hope for the best." I know there's a lot of women that will take that approach. I need immediate peace of mind that my risk is gone, nothing's growing, and it's all taken care of.
Yeah.
But, walking out of the doctor's office, I called Rick. Of course, we make the appointment for my mastectomy right then and there.
Wow.
Basically just to get me on the calendar,
Sure.
And it wasn't until the end of January. This was December 14th. So I walk out, of course I'm smiling at the woman at the reception desk. There's that whole, like, I just got the worst news of my life. I'm sure they can see that I've been crying. But you do what you have to do.
Put on the brave face.
So I walk out and I get out of the actual building and I call Rick, which he doesn't always answer because he's, we're at work, working. But he did answer and I said, "I have breast cancer." And he said, "Okay, I'll be right home." And it's not often that, like, I know that he was scared. Like, I could tell because he was like, "I'll be right there." And then my mom knew that I was going to this appointment. And apparently she was more concerned than I was. And I was like, "I'm not calling her yet. Like, I just need time. And I don't want her to worry about me." So I had only gotten a few miles down the road and she called me.
Ugh.
She's like, "So are you out? Did you have your appointment already?" And I was like, "Yes, I just left." And she's like, "So?" I said, "I have breast cancer." But it was like that whole, "But I'm fine. It's fine. It's like best case scenario, don't worry about me. I'm okay." And, anyways, she's like, "Well, we'll be there. When you have your mastectomy, we'll be there. We can help any way we can." So anyways, then I get home and Rick and I just, I don't know.
Right.
What do you do?
Yeah. Gosh. I want to switch gears a little bit and come to Rick. I think there's multiple stories that we can go through, and being a good friend of yours, if I can call myself that, I think there's parts that I didn't know, or I'm going through my life and probably wasn't there in the ways I probably should have been for you. Yeah, I can say that. But in the interest of stories, and I think that's the whole reason Overcoming Average exists, is to find the stories of people living the everyday life, but doing extraordinary things, and sharing those stories with others. And so I think there's multiple stories here, which is why Rick is with us. aside from his co-hosting duties, he's personally invested in this story because he's a character in it. So, Rick, I want to switch gears a little bit. You are at work, a husband, a dad. You hear the news from your wife who calls you, knowing she had that appointment that day, and hear the words that you were probably, I don't know if you fortified yourself mentally in the same way Melissa did to convince yourself this isn't happening, this is not us, but now it is. Walk us through what went through your mind in that moment and how you navigated that.
Well, on my one mind, the medical side, I'm like, okay, worst case, stage 1 cancer. So, and I think every diagnosis of cancer is like an 80% chance of survival rate. So we're really good at treating it. So
In your head, were you thinking breast cancer? Like when?
yeah.
Okay.
Yeah. So 80%. So in my one mind, I'm like, okay, we caught it really early, so it's not. And then the other side is like, oh my gosh, I just need to be there for her. She's just a mess. So just being there for her. But yeah, so I on one hand had peace, but then I knew she was hurting. So,
Yeah. So you scheduled the mastectomy. As a mom, Liberty is 9 now. Your daughter, and Paxton, your son, is 7 now.
Be 7 soon.
Yeah. So at the time, they're what, 5 and
Liberty had
almost
just turned
6?
7.
Okay.
So
Oh, gosh.
5 and
So
7.
good at math. Did you together talk through how do we talk to the kids about this? Is this something we even mention? I know a lot of people listening are moms and dads. Whether or not they're walking through this, maybe they can learn from what you went through. How did you broach that topic with the kids?
I don't remember. I know Rick and I must have talked about what we were going to say. We waited a little while, maybe 2 weeks before surgery. I'm not someone that wants to hide something from my kids. Like, I know they were young, but I also know that they can understand some things. And I would rather them understand that, you can't lay on mommy right now, or, because these, why. So we just told them, I have basically cells in my body that are sick. It's called cancer, and they just happen to be in my boobs. And the doctor's going to take them out so that, I won't be sick. And luckily, I'm not sick. Like, cancer can make some people very sick, or they have to take medicine that makes them really sick. But I'm lucky that we'll just do this surgery, and I'll be okay. And, you could see them processing. I think Paxton, he was only 5. I don't... Yeah. I mean, even the other day, they're doing a fundraiser at school for leukemia and lymphoma. So I explained to him what that was. And even the other day, he said, "Mommy, have you ever had cancer?" And I was like,
Yeah.
"Oh, wow." Apparently all that went over your head,
Yeah. For better or for worse, but yeah.
Right. So that was how we, I'd rather be open and honest.
Oh, yeah.
And,
Absolutely.
Liberty asked a few questions. I said, and then they're going to take everything out of my boobs and then basically put like balloons in so that I have boobs again.
And that's what you needed to know. And that, yeah.
Right.
Okay.
Yeah. We're always pretty open.
Oh, yeah.
With stuff with them.
I subscribe to transparency in parenting, for better or for worse.
Right.
So, you went in, this was the end of January. Okay. And you're getting ready for surgery. How did you prepare for that? I mean, I'd be foolish to think that that's not a big struggle mentally, emotionally for our identity as women. I mean, we are women. We have breasts. That's a part of our appearance. Men particularly enjoy them. Yeah. So you're getting ready for the mastectomy. And one thing that I just want to unpack, and with you, and I don't know how you went through this, but I think any one of us women who are faced with the understanding, the reality that we're going to have a mastectomy, knowing there's reconstruction afterwards, but how did you wrestle with that? How did you prepare with that? How did you process that of something that is so, whether or not you agree with this, you subscribe to this, but that is so intertwined with your womanhood and your body, your image, your sexuality of having breasts. I mean, to kind of walk us through what that was like for you. How did you reconcile that? How did you mentally prepare yourself for that? Because you've already showed us that you have a strong mental fortitude. Anyone who runs cross country to me has a strong mental fortitude. But in facing this, what was your mindset? How did you prepare for that?
Honestly, I think going into it, like I had said before, I had always thought in the back of my head about augmentation. I was not blessed in the chest. So I had always considered it. So in my mind, I think I was thinking, I'll just go through this mastectomy and then I'll get the boobs I always dreamed of, you know? It's just that simple. And honestly, I didn't do any research mentally. I couldn't handle putting anything more on my brain, like making decisions or, you know, I know there's some people that get peace through researching things to death. I just needed to go in, have my doctor say ABC, okay, I'll choose that and be done with it. So I really didn't even know anything about the process leading up to it until I actually didn't even have my first appointment with the plastic surgeon until 5 days after my mastectomy. But so anyway, leading up to the mastectomy, like as far as mentally, I was like, let's just do this, get it over with, and then I'm gonna have this dream body afterwards. So I know I got to like maybe a week beforehand, and Rick came home from work and I was at my sewing machine. He's like, so what are you doing? I'm like, I need to make this pillow. Like I found this blog online and she said, you need this pillow for after surgery. And it makes whatever. Like that was my moment of like, I need to do something and I don't know what to do and I don't feel prepared. Yeah. So then it wasn't until I went to the plastic surgeon until the whole process was laid out before me. And at this point, like I said, I'd already had the mastectomy. So I didn't know it was going to be minimum of 6 months.
I think we determined that it was a mistake to do the two separate. If we had to do it again.
If I had had the mental space to do research, I would have researched and found that. So basically, the hospital that my surgeon works out of doesn't have a plastic surgeon that takes insurance. So basically, they're just doing purely cosmetic procedures and taking cash pay because that's what people do.
Right.
So she said, I don't have anyone that tag teams. Normally, you'd get your mastectomy. That surgeon would tag out. The plastic surgeon would come in and put in the expanders, like do the next step. But at the hospital that my surgeon was at, there wasn't a plastic surgeon unless we wanted to cash pay, which obviously not what we wanted to do. And like I said, I didn't do any research. So she said, this is a plastic surgeon. I suggest he seems to have good results. People seem to like him. That's who I refer my patients to. So I didn't do research to see if there were other options close by. So I had to go for the mastectomy and then wait until the plastic surgeon could get me in to do the next step, which is expanders.
We could have saved 1 or 2 surgeries if we did it together. So
yeah.
After the mastectomy, did they do any follow up with where you stood as far as, I don't even know if this is a natural step or part of the process of, hey, we did this, we got it all, or we want to confirm that what we, the prognosis of 5%, that's still accurate after the mastectomy. Was there any follow up on that? Was there any kind of touching base with you regarding the effectiveness of the mastectomy, or was it just, hey, it's done and it is what we told you to? I'm just curious about if as far as the cancer treatment is concerned, if there was a follow up regarding that.
So I remember, so the mastectomy was on a Friday, and there was a topical medication that I was using that was giving me horrendous migraines, like the worst, the worst headaches. I thought my head was going to explode. So I'd called the surgeon on Tuesday to say, is this normal? Is it necessary? And she called me actually at like 6 p.m. that night, and said, oh, by the way, I just got your pathology back from the mastectomy and you were all clear. Like, everything. The margins are good. Everything's clear. There's no concern there. And, but again, for some reason, I'm not an optimistic person, but going through this whole process, I was so optimistic that that step was going to be the final step. Like there wasn't going to be a next, a next negative result or positive, I guess.
Would you like to tell the nipple story?
I mean, I guess.
Oh gosh. I might take those co-hosting duties away from Nick.
Well, I think it's an important part of the story.
Is.
Like this is.
Sure.
I found that because it's breast cancer, it makes it awkward for people to ask about.
Sure.
And that was part of the process for me too. Like people would say, "Oh, how you doing?" But you could tell the difference between a "Hey, how are you doing?" and "Hey, how are you doing?" And so one of the situations, I don't know. There are some surgeons, and back in the day, they did mastectomies and they would remove your nipples because that just increases your chances that there will not be.
So you say back in the day, tell us what that means in your head. What are you saying?
Like probably not even that many years ago.
Like a decade or so?
Possibly.
Okay.
The surgeon, they would do the mastectomy. They would remove your nipples to remove all risk.
Tissue. Yeah, that makes sense. So with yours, did they do that as well or no?
So they did not. I kept mine. And that's what the medication was.
That's where the 5% of recurrence is.
Got it. Okay. Yeah, no, that's exactly what we want to know.
And there's some women that would say, just go ahead and remove them because it's not worth the risk. Mostly that's probably women that have had it recur in their nipple. So, but for me, I chose to keep mine because again, it seems silly but as a woman,
it doesn't seem silly though.
That's part of you.
Sure. Yeah. It's perfectly natural.
So for my lumpectomy, the surgeon had to, I don't know how in detail, but anyway, they basically cut my nipple or around it, the areola, and removed it. And then that's how they gained access to where she needed to remove the cells. So then when it came to my mastectomy, did they have to cut it again?
I think they cut the nipple the first time, and then they cut the underside of the breast.
The anchor.
The second time.
Yeah.
So there was concern that because they were cutting the blood supply again, that the nipple could die. Like this is just a risk. The nipple can die, and we end up having to remove them anyway. So this medication that was giving me the migraine like headaches was a medication to increase blood flow to my nipples. So I was putting this ointment on to keep them. But in return, it was giving me like
massive headaches.
Oh, yeah.
Massive.
And this was a topical medicine
Wow.
that gave you headaches. That's crazy.
Right.
I think I've heard that before.
Right. So,
It's the medication that they give you when you have a heart attack.
so what is it called?
You put it on your tongue. Oh my gosh.
When you're having a heart
My
attack?
brain's going.
We'll
But
Google
anyway,
it.
basically, it's a topical version of that pill that people that are
Wow.
having a heart attack take
Okay.
to dilate your vessels to make the
Okay.
blood flow.
Yeah, makes sense.
So, yeah, I mean, so in my mind, I'm thinking I can try to fight through these headaches or I can lose my nipple. Like, you know, and it got to the point where I was like, I don't even care anymore. I can lose
Yeah.
my.
You took like one 12-hour off,
I did.
and then
It turned gray.
it turned gray.
Oh no.
And that's when I
Really?
called the doctor and was like, okay, is this normal? Like, are the headaches normal? Like, what do
Sure.
I need to do? And it was just a superficial layer of skin that had died off in that 12 hours.
We were then more serious.
And we were
I
good.
think we did half. We didn't do a
Well,
full.
Rick's idea was, well, if it says like a little bit works, like, what about a lot?
I did not say it. I did not say it.
So we were putting,
Advice from Dr. Stewart.
basically we were putting too much on
I don't
and it
think
was
so.
Okay.
causing too much.
So they were saved.
Yes, so my
Okay.
nipples were saved.
Well done.
Hallelujah.
But I recently, over the summer, talked to a friend, and she went through a prophylactic, I don't know, I never say that word right, mastectomy, because her mom actually died from breast cancer. I think her grandmother as well. And her surgeon doesn't keep the nipple. So, I mean, there's options. She got hers tattooed back on. So you can get tattoos. So there's still the appearance. There's options.
Yeah.
There's
Okay.
options.
Wow. There's so much that I'm learning that I didn't
Yeah, I think that's
know.
important for
Yeah.
if somebody's in that stage.
That's good for them to know, because that is not something that's regularly talked about
Right.
unless you're in the midst of that. So that's good to know. So, you had the mastectomy. You went for the reconstruction. What was the difference in time between those two surgeries again?
So it took 3 weeks.
Okay.
3 weeks. January 25th was my mastectomy. February 15th was my first step in reconstruction. And actually, apparently my plastic surgeon's a very busy man. So it would take him, they would have to get insurance approval before they would schedule me. And that takes a week to 10 days or something. And then they would schedule. So I had gone for my follow-up mastectomy appointment, and I'm like, they haven't contacted me yet. And I got the call like the next day. You know, I think she kind of, so anyway, he got me in 3 weeks, which
Oh, nice.
at the time seemed like forever, but
Yeah.
after working with him for another 6 months or so.
I just wanted to say too, with my mom's cancer, she has throat cancer, and she just finished her chemo and radiation, and I won't even go into all the roller coaster of like,
Can't imagine.
the common person that's just living their daily life. All of a sudden, your life is like doctor's appointments, and wait, was it Tuesday or Wednesday? Oh, it's this doctor and that doctor in Mooresville and Concord, and one of our friends, he's been struggling with a rare type of brain cancer, and he told me while my mom was in the midst of it that you have to be your own advocate for a lot of this stuff. Like, you've got to push to get the appointments, and nothing against the people doing their jobs at the hospitals, but they're regular people. They're tired, they're overloaded, they got stuff going on, they're living in this pandemic and stuff too. But
Right.
sometimes you got to push. Hey, when's the appointment? What am I meeting you for? What is
Yeah.
this shot you're giving me? Ask lots of questions and not just go through the motions, because it's you have to
Right.
you have to advocate for yourself a little bit. So
And I'm so thankful that I didn't have any additional treatments. Like, my biggest stress was, when are you going to schedule this next surgery? Like, you already have insurance approval from the last surgery. Surely the insurance isn't going to say, oh, we're going to stop her mid-process and
Right.
that's it. Like, and then I'm only talking to the scheduler, and I know she's just doing her job.
Right.
Like, I know that she's probably not going to go back to the surgeon and say, hey, Melissa Stewart is really wanting to get in, like, it was so frustrating that part of
And it's
it.
also too, 3 3 weeks and your body is going through major changes
Yeah.
that I think in 3 weeks probably felt like eternity to you, but
Yeah.
also for your body, that probably was some good time for your body to recharge. Maybe,
Probably,
I don't know.
yeah.
I might.
From a medical standpoint, like then the skin wants to scar down onto the pec muscle. So then the spacers were more painful probably than they had to be.
Oh.
Yeah.
So
Yeah.
I wouldn't recommend it. I would rather do it all in one shot.
Yeah.
Yeah.
Looking back, do
So-
you wish you could have done that?
Yes. And actually, I had someone reach out to me a couple months ago. A local mom. I had commented on something in a mom's group, and she, like, it's been a while since I made the comment, and somehow she found it because she had the same diagnosis. So she reached out and asked, just about the process and everything. And I said, if there was one thing I could change, I would research, see if there's another option of surgeons that you can just get the whole process, the mastectomy and then start the reconstruction all in one.
Yeah.
So the process is they do the mastectomy, then they put in they're basically temporary implants that are empty. They're called expanders. And they have a more like stiff, rigid skin to them. And there's a port so that they can put a syringe in, and once a week you go in and they slowly fill them little by little to stretch what they call the pocket where the permanent implant will go. So it slowly stretches it out and gets you ready for the permanent implant. So she did her research. She actually found in Huntersville, there was a breast surgeon and a plastic surgeon that tag teamed. She was actually able to get her mastectomy and go right to the permanent implant.
Wow.
She probably will have, they call it like a touch up. So after things start to settle, they'll kind of look and say, how they can tweak things. But to think that I could have saved myself 2 surgeries, but like at the time, like I said, at the time, I just didn't have the mental space to go there.
Sure. Or the information,
Right.
which is, half probably most of the battle. So
Right.
since then, I know that you've had a touch up, I guess, if you would say. Have you seen or come across any additional communities or Facebook pages or anything where this is something that people are seeking to tell their stories, to advocate, to provide additional information, having gone through it like you have for other moms like this woman who reached out to you?
Yeah.
Have you found any communities like this, engaged in that? Do you think there's a space for that needs to be filled?
I'm sure there's a place, to be honest. I think for me, I'm just ready to put it behind me and move on. I think there's a place to share my story like here. I guess maybe I'm protecting myself that I don't need to hear someone say, I went through all of it and then I got cancer again. I don't need, I just don't feel like I need any more information. I made the choices I made. We're through it. And I can't go back and change anything.
Sure.
But that's just me, you know?
Yeah.
No,
and like I
absolutely.
said, I do.
And that's your story.
I've always wanted a place to share my story. So actually that other woman reaching out to me was like, I told her, I said, this is just as good for me, I think, as it is for you, for me to be able to talk to someone else that understands, but not in like an anonymous, large, social media group.
So now you're on the other side of it. Tell us how you're feeling, what your day-to-day is. Are you back to normal as far as your normal pre all of this diagnosis? Talk to us kind of about where you are today.
Yeah. So it's been, my last surgery was December 2nd, 2019. So it's been just over a year. I think the one thing I do want to talk about that it feels really important to me. Like you said, you get this diagnosis, and you still have life that goes on.
Yeah.
I still had a child that had to get to preschool and home from preschool and ready for school, like all that normal day-to-day stuff. And in the background, I'm dealing with, okay, when is the surgeon going to call me to give me a surgery date? And, all that. And I realized when I got through, so what I thought was going to be my final surgery was June of 2019. And I got through it, and leading up to it, I was like, this is the end. I'm done. I can't wait to just be done and over with it. And then I got through it, and I quickly realized I'm not okay. Like, I'm not feeling that relief of, I'm done. And some of that was disappointment in the cosmetic outcome. And some of it, I realized I had just put my head down and did what I had to do to get through that 6 months, and I wasn't, as I saw a counselor a few months later, she explained, like, you weren't processing, like you were just doing what you had to do to get through it, and you weren't processing. I don't know how to do that differently, even looking back, but I think people going through this should be aware, like, there can be that, like, you get to the end and, like, it's not that relief, that I don't really know how to say it, but for me anyway, that was my experience. And it was just, I didn't see it coming.
If you were, because I'm seeing this as a friend, and there's parts of this that I didn't know, that I didn't realize, that I'm like, crap, I should have stepped up a little bit more. So if there was something that you could tell me as your friend, or other women who are walking alongside a friend, a girlfriend who's going through something similar, what is something that they can do? What is something that they can say or not say that you think might aid somebody in walking through what you walked through?
I think for me and just my personality, the process was so long. Well, I should start by saying, I know the first text I sent to Kim and the other two women that we're close to was, don't worry, but I have cancer. So that was my whole, like, don't worry about me, I'm fine. Like, and that was just, that's just my personality. Like, I don't want people to, I guess, fuss over me. I say 3 months after my 40th birthday.
Oh, we fussed over her. Don't you worry.
And then it got to be that the process was so long that as I got, 3, 4, 5 months in, it was like, people don't have time for that. It just felt like so long. And
I think people need this self-awareness individually to find out how they need to walk through it, because I mean, living through my mother-in-law's cancer and my mother's cancer and stuff now, it's always in the back of your mind,
right?
Kind of like, no matter what you do, like I said, you're eating cereal and you're just, it's like it's there even though it's not there for me.
Yeah.
And I personally noticed, I think in myself and maybe even for Kim, just stress that just normally wouldn't be there, and you think, why am I so irritable or stressed? And you think, oh,
there's just that underlying,
because there's like a huge life issue going on here, but I've got to fill the car with gas, like it's mundane task,
right?
And there's a weight to that, and even if it's the knowing, I mean, you guys had the early detection, you had the numbers, you had a husband who had a strong sense of the medicinal aspect of that and the reality of that. I think there's always the I say grief because I think grief comes in a lot of different ways than we anticipate grief, beyond just a death of a loved one. But there's grief of the life that you thought you'd live and walk through, and mourning the loss of that, of the picture you paint in your own mind, and having to grieve that and reconcile the fact that my life is not going to be the life that I had anticipated it to be. And it's going to be okay, but it's different.
Yeah.
And reconciling that.
Yeah.
And it takes a lot of headspace to work through that, to wrap your head around that, to continue walking through your day to day, the preschool drop offs, the making of lunches and doing the hair before kindergarten, first grade, second grade. And the day to day, there's a lot of processing and working through that mentally, physically, emotionally in your own space as your own person, and then doing the same as the mom, the wife, the friend, the runner. There's just a lot of different facets to that.
Yeah.
And we're both speaking from people who've been by the sides of those who've walked through cancer, who've lost to cancer, and not being the one living that I can just, I can't even wrap my mind around what it would be like to be one living with that I think that's why it's so important to have your story be told, and that, we told their husbands to move over and make way for us because we have stories that need to be told and be heard. And so,
Well, I want to say too, quickly, to go back when you were saying, you don't feel brave, but that's what all the heroes in history say. They just, in war, they just did what needed to be done. Mm-hmm. So I think you should be proud of yourself for just putting your head down and getting through it for your family and for your friends. And
there's real quickly off of that, there's a story that my juniors, I forced them to read. And there's, we asked them to discuss, the nature of courage as defined by this author exploring Vietnam War. And he says, courage is not necessarily getting up and fighting and doing these great deeds, but it's sometimes just sitting in the quiet and in the peace and knowing that what's coming your way is unknown, but being ready for that.
Yeah.
And it looks a lot like not doing anything, but it's in the not doing where the courage is the strongest and the most inspiring. And we obviously feel that. So we thank you for telling your story.
Thank you.
Yeah, I was thinking too, I started with statistics on cancer, which is it's just shocking. I mean, we see that many people that are diagnosed every year, almost 2 million people. And if you add heart disease, which is a whole nother monster on top of it, it's a majority of deaths in the United States is heart disease and cancer. It's like, you just can't help but feel like, why doesn't somebody do something about this? Like, it's a very complicated, I know all the cancers are different and everything, but that being said, I think it's just so important to share your story. So thank you for coming on. It's brave of you to talk about it.
I appreciate it. Like I said, I've wanted a place that I can share because I do think it's important. And sometimes I think, why did I walk through all of this if I'm just going to keep it to myself?
Yeah.
I don't think we're made to experience hard things just for it to be hard, So,
ladies and gentlemen, the amazing Melissa Stewart. Thanks. We'll see you guys next time.